Hello students, today we will be discussing about polycystic ovarian syndrome. A very important disease but a very confusing disease. This disease was first discovered by 𝗠𝐤𝐼𝐻𝐿 in 1935. So we can call PCOS, polycystic ovarian syndrome, can also be called as 𝗠𝐤𝐼𝐻𝐿 syndrome. Okay, so what is the etiology? What is the etiology of PCOS? Guys, the etiology of PCOS is unclear. Okay, it's very unclear that we don't know why exactly these polycystic ovaries are happening. Now, as we don't know the etiology, but we know the environmental factors, genetic factors, and a lifestyle. These factors may predispose a female for developing the polycystic ovaries. Before going to discuss in detail about the polycystic ovarian syndrome, now let's see the diagnostic criteria. Okay, trust me guys, by the end of the lecture I'll be giving all the data which is available. Okay, all the data which you need to keep in mind for your exams, that will be discussed. Okay, don't worry. But if you want to label a patient as a PCOS patient, she should have to fulfill certain criteria. So the criteria for diagnosis of a PCOS is, anyone? The criteria for diagnosing PCOS is Rotterdams Criteria. Okay, a very important MCQ. For the diagnosis of PCOS, the criteria used is Rotterdams Criteria. So, under Rotterdams Criteria, what we have to know? Rotterdams Criteria includes three important features. Feature number 1 is oligomenorrhea or amenorrhea. Okay, see, the amenorrhea clinically it's going to present as no periods. Okay, the female is going to come to the clinic with a complaint of, doctor, I'm missing my periods. Now, the second criteria in Rotterdams is hypoandrogenism. Okay, hypoandrogenism. See how this clinically presents. A female with high levels of androgens is going to present to the clinic with the chief complaints of hirsutism. Okay, a very important MCQ. So a female with PCOS will present to the clinic with the features of hirsutism. Please keep that point in mind. Now, the third important criteria for diagnosis of PCOS is a radiological sign, which is enlarged ovaries on ultrasonography. Okay, so if you visualize the ovaries under ultrasonography, you will be seeing that the ovaries are enlarged, giving a characteristic sign, which is a string of pearl sign. Okay, a string of pearl sign is seen in PCOS. Now, there are certain other criteria, but they are not diagnostic. What do I actually mean? Guys, please concentrate. If you want to label a female as a PCOS female, out of these three criteria, she should fulfill at least 2. Okay, 2 out of 3 criteria should be fulfilled by a female to be diagnosed under PCOS. Okay, a very important point is 2 out of 3 criteria should be fulfilled to diagnose a female. Okay, there are certain other association. Okay, there are certain other association, but they are not the diagnostic criteria. They are not the Rotterdams criteria. So what are they? Even a female with PCOS can present to the clinic with obesity. She might have obesity. Okay, most of the patients with PCOS, they will be obese. Even thin patients can have PCOS, but obesity is most commonly seen in those females who are having PCOS. Now, insulin resistance. Okay, we will discuss in detail about everything, don't worry. So what are the 3 important Rotterdams criteria, guys? See, what and all I am highlighting here, these are the Rotterdams criteria. Okay, obesity and insulin resistance are not the Rotterdams criteria. Please keep in mind, even if a female is not having polycystic ovaries and ultrasonography, she can be diagnosed with PCOS. Why? Because at least 2 out of 3 criteria are needed. Only if she is having amenorrhea and hyperandrogenism, hirsutism. Only these 2, if a female is having only these 2, you can diagnose her as PCOS. Okay, no need to have enlarged ovaries all the time. Please keep that point in mind. Next, now let's discuss a very important key hormonal abnormality seen in PCOS. Okay, from here you should be more attentive. Key hormonal abnormality. Key hormonal abnormality in PCOS. So what is the hormone that's going to be abnormally elevated in PCOS, guys? If you are saying it as LH, you are absolutely true. Okay, so high levels of LH hormone. So the LH levels are very high in a female with PCOS. If there is a too much amount of LH, what this LH is doing? This LH will give a positive stimulation for which cells, guys? This LH will give positive stimulation for 𝗓𝐾 interna cells. Now this 𝗓𝐾 interna cells under the influence of LH is going to make androgens. Okay, so a female is having too much amount of LH. As there is too much amount of LH, this too much amount of LH is going to stimulate the 𝗓𝐾 interna cells. So even in a female, we can expect lot of androgens. Now, what's the main thing? What's the main problem here? See, this androgens, too much of amount of androgens, especially these androgens are going to the peripheral tissues. Peripheral tissues. Peripheral tissues, I mean adipose tissue. Okay, so in the adipose tissue, these androgens, they are going to be converted into estrogens. Okay, especially estrone even. Okay, so in the peripheral tissue, these androgens, they are going to be converted into estrogens. What is the enzyme required, guys? The enzyme required for the peripheral conversion of androgens into estrogens is, I know you know it, it is aromatase. Okay, so with the help of aromatase, the androgens will be converted into estrogens. So what? Too much amount of LH. That too much amount of LH is going to make too much amount of androgens. If there is too much amount of androgens, the too much amount of androgens will be converted into too much amount of estrogens. So a female with PCOS will have too much amount of estrogens. So what's wrong? It's definitely wrong. This too much amount of estrogens will give negative feedback for FSH. A female needs FSH. Why do we need FSH? In a female, follicle stimulating hormone stimulate the follicles, so there will be growth and maturation of the follicles, so that ovulation will happen. As there is less amount of FSH. This less amount of FSH don't let the development of follicles. So what happens to the follicles? The follicles will become atretic. The follicles become atretic. Okay, the follicles become atretic. As the follicles are not growing properly, there is no ovulation happening. So a female with PCOS will have complaint of an ovulation. A female with PCOS will have a complaint of anovulation. Absolutely true. Guys, when we are studying this gynecology, what is the basic point we have to keep in mind? Ovulatory cycles are regular and painful. Anovulatory cycles are irregular and painless. Here in a female with PCOS, the cycles are anovulatory cycles. So she will be having irregular menstrual cycles or irregular bleeding. Okay. So a female with PCOS, as she is having anovulatory cycles, anovulation is going to cause anovulatory cycles. As she is having anovulatory cycles, she will be having irregular menstrual bleeding. Okay, irregular menstrual bleeding. So as she is anovulatory, there is no ovulation. Is there any possibility of pregnancy? No. So a female with PCOS will have the complaint of infertility. Okay, infertility. Okay, everything is related. Okay, please guys keep in mind, a female with PCOS is going to have anovulatory cycles, which makes her every month cyclical bleeding irregular. So she will be present to the clinic with irregular menstrual bleeding. She will be going to come to the clinic and she will be saying that not having my cycles regular. Okay, they are not following the monthly cycles. I am having cycles, okay, for every 2 months, 3 months or 4 months. Irregular menstrual cycles will be seen. And as she is having anovulatory cycles, she will be having a complaint of infertility. After this, what else we have to keep in mind? Guys, also concentrate. Estrogens are giving negative feedback for FSH, but the same estrogens will also stimulate LH release. Okay, already the patient of PCOS, she is having too much amount of LH, but these estrogens are giving again positive signals for the release of LH. Okay, we know it. Estrogen stimulate the release of LH. Clear? Now, let's discuss about insulin resistance. Insulin resistance. Okay. Now, guys, if a female is having insulin resistance, what do you think? What do you think the levels of insulin in her? The levels of insulin in this patient will increase. So there will be high levels of insulin. Why it is important? These high levels of insulin again will stimulate 𝗤𝐾A cells. Okay, these high levels of insulin will stimulate 𝗤𝐾A cells. Now 𝗤𝐾A cells are again making androgens. From here we know the story. Okay, these androgens, they will be converted into estrogens. Okay, so there is one more tie-up for making more androgens and more estrogens. Now, one more important point which needs to be kept in mind. This insulin along with androgens, they will act on the liver and suppress. They will act on the liver and suppress the production of sex hormone binding globulins. So the sex hormone binding globulins, which are the plasma proteins which are bound with the androgens and estrogens. Now, under the influence of this androgens and insulin, there is a decreased synthesis of sex hormone binding globulins. So what happens? If there is no sex hormone binding globulins, the estrogen and androgens, they are now in free form. Okay, now the estrogen and androgens, they are not bound with any of the sex hormone binding globulins, so now they are in a free form. Why it is important? As they are in free form, they are biologically active. Okay, as they are biologically active, they will give more clinical conditions. Now this estrogen will again give negative feedback for the FSH. Okay, they are biologically active. Okay, from the pharma point of view, you have to know those hormones which are not bound with any of the plasma proteins, they will become biologically active. Okay, now we have seen. So what else we have to discuss? Guys, once concentrate. In a female with PCOS, she will be having too much amount of estrogens, there is no doubt. Please concentrate here. A female with PCOS, she is having too much amount of estrogens. She is having too much amount of estrogens. Okay. Now this too much amount of estrogens, what they are actually doing? These too much amount of estrogens, we know these too much amount of estrogens will give a positive signals for the proliferation of a uterine endometrium. Okay, well and good. Guys, please concentrate. As she is anovulatory cycles, as she is having anovulatory cycles, there is no ovulation, no corpus luteum. If there is no corpus luteum, there is no progesterone. Only estrogen is there. Only estrogen is dominant now. As there is too much amount of estrogen, there is a too much proliferation of the uterine endometrium. Too much stimulation for the uterine endometrium. Too much stimulation is all the time bad. So she might end up with endometrial hyperplasia. Okay, so she might develop endometrial hypoplasia because of too much amount of estrogens. This endometrial hypoplasia can lead to, yes, endometrial cancer. Okay, a female with PCOS, she is at a more risk of getting which cancer, guys? Endometrial cancer. Okay, please keep that point in mind. And also remember, as she is having anovulatory cycles, please concentrate. Anovulatory cycles, no corpus luteum. If there is no corpus luteum, no progesterone. If there is no progesterone, what happens? Only estrogen will dominate, and that estrogen can cause estrogen hypoplasia. Sorry, that estrogen will cause endometrial hypoplasia and lead to the endometrial cancer. Okay, now what else we have to discuss? Please concentrate, guys. After discussing all the clinical features, what are the clinical features? A female with PCOS, as she is having too much amount of androgens, remember this too much amount of androgens, first of all they will cause hirsutism. What exactly is hirsutism? Hirsutism means like a male pattern hair growth on on the lip line, or hirsutism includes acne. Okay, now this high levels of androgen is going to cause hirsutism. Okay, well and good. This is one of the clinical feature. Second clinical features are because of high levels of estrogen. As there is high levels of estrogen, there is a decrease release of FSH. Whenever there is no FSH, no follicle stimulation, no follicle maturation, and no ovulation. All the follicles, please concentrate, all the follicles, they are now, see, this is the ovary. All the follicles which are immature follicles, okay, which are in very, very small size, they are getting atretic. They are localized in the periphery of the ovary, which gives a string of a pearl sign. Okay, now actually these are not the cysts. Actually these are the follicles, small follicles which are underdeveloped. They are located in the periphery of the ovary, giving us the radiological sign of string of pearls. Okay, now hirsutism is a clinical feature. Anovulation leading to irregular menstrual bleeding. Okay, that's the one clinical feature. As she is having anovulation, she might be present to our clinic with the infertility. Next, what else a female with PCOS can present to our clinic? As she is having high levels of insulin. Why she is having high levels of insulin? Because of insulin resistance. Okay, so even insulin resistance can be seen in a female with PCOS. If she is having insulin resistance, okay, she will be having abnormal glucose tolerance. Okay, keep those points in mind. Next, let's discuss about the treatment. Okay, treatment part. Now, in the treatment part, first we will be asking the female to decrease the weight. Weight loss, this is the first thing we will be asking the patient to do. Why weight loss? If she is decreasing her weight, she is decreasing her adipose tissue. She is decreasing her adipose tissue. If she is decreasing her adipose tissue, there is a decrease peripheral aromatization. There is decreased peripheral aromatization. If there is decreased peripheral aromatization, it will decrease estrogens. Okay, that's a very good thing. Okay, in a PCOS female, you have to decrease the estrogen levels. So if the estrogens are decreased, again FSH will release. Okay, estrogens decrease, it will stimulate the release of FSH. Now, you will be asking the patient to reduce her weight. A second thing which you will be doing here in a PCOS female is giving her metformin. Okay, what kind of drug is metformin? Metformin is anti-diabetic drug. Okay, metformin is an anti-diabetic drug. Though this female is not diabetic, even if she is not fulfilling the criteria of diabetes, give the patient metformin. Why? Because giving metformin in a female with PCOS gives a very good results. Okay, metformin will treat the insulin resistance. Okay, very good for insulin resistance, and even weight loss will decrease the insulin resistance. Okay, which is very good in these females. Now, what else we can give to this female? Progesterone. Progesterone. How progesterone is helpful? Either I can give progesterone or I can give progesterone in the form of OCPs, oral contraceptive pills. How this is going to be helpful? How means progesterone will give a negative feedback for the release of LH. So LH levels decrease. If there is decreased LH levels in a female with PCOS, that's a very good sign. Why? Because if there is no LH, no androgens. There is no androgens, no estrogens. That's a very good sign. Okay, so you can give a progesterone to this female. Now, what else? As she is having a complaint of infertility, for the treatment of infertility, you can use ovulation inducing drugs. Okay, ovulation inducing drugs you can use in a female who is on PCOS. What are the classical ovulation inducing drugs, guys? Yeah, I know you know it. It is clomiphene citrate. Clomiphene citrate, a classical ovulation inducing drug. And one more important drug, for especially for our exams, you need to keep in mind, it is a letrozole. Even you have to remember, letrozole is the drug of choice for ovulation induction in a female with PCOS. Okay, so previously we used to say like this: clomiphene citrate is the drug of choice for ovulation induction. But it's a recent update, letrozole, which is an aromatase inhibitor, a drug of choice for ovulation induction. Now, what else we can do in a female with a PCOS? Now, this PCOS female, she is also suffering with hirsutism. Now, how can we treat this hirsutism, guys? Hirsutism can be treated with oral contraceptive pills. Oral contraceptive pills are the first line drugs for treating hirsutism. We can also use spironolactone. Okay, spironolactone, which is an anti-androgen. So these two drugs can be used for the treatment of hirsutism. Guys, I just want to give some time to discuss about clomiphene citrate. Clomiphene citrate. Why? Because a lot of times MCQs are being asked on clomiphene citrate. So what kind of drug is clomiphene citrate and how exactly it's going to cause ovulation induction in a female? Clomiphene citrate is partial estrogen receptor blocker. Okay, clomiphene citrate is a estrogen receptor blocker in central nervous system. See, if estrogen receptors are blocked, it just looks like estrogen is not there. Your central nervous system is perceiving that there is no estrogen. So, central nervous system anterior pituitary is going to release now FSH. FSH is now releasing. Now this FSH will stimulate the follicles. Now the follicles, they will get stimulated, they will grow, they will develop, they will mature, and ovulation will resume. Okay, so clomiphene citrate, very important point, it's a estrogen receptor blocker. Now side effects of clomiphene citrate. Okay, now number 1, the main important side effect of clomiphene citrate is hot flushes. Hot flushes, which are especially seen in a female, in a post-menopausal woman. Okay, so hot flushes are seen. Why hot flushes? Why? Because whenever there is a decreased estrogen levels, you can have hot flushes. Giving clomiphene citrate is blocking the estrogen receptors. So central nervous system is perceiving, okay, now central nervous system, it gets blinded, so it cannot see the estrogen. So simply it just like there is no estrogen in the body, so hot flushes will be occurring. Now next one, other than hot flushes, you can expect multiple pregnancy. Okay, a multiple pregnancy can occur. Number 3, ovarian hyperstimulation syndrome. Okay, ovarian hyperstimulation syndrome. Why? Because FSH is now releasing. This FSH will act on the ovaries and stimulate the ovaries. Sometimes there is a risk of ovarian hyperstimulation syndrome, and sometimes you can expect ovarian cysts, ovarian cancer. In few females, after taking this clomiphene citrate, they experienced visual abnormalities like double vision, scotoma. Okay, all these are possible. So visual abnormalities. Visual abnormalities can be seen after using clomiphene citrate. Now last and final, gastrointestinal and breast disorders, okay, can be seen. Guys, please keep in mind clomiphene citrate is a very important drug. It's a estrogen receptor blocker which will be used for ovulation induction, but this is not the drug of choice. Letrozole is the drug of choice. Letrozole is a aromatase inhibitor. Okay, now after knowing the side effects, after seeing the side effects, what else we have to keep in mind in exam point of view, okay, in the topic of PCOS. Now syndromes associated in PCOS. What are the syndromes which are associated in a female with PCOS? What, like, sometimes they associated. What are they? Ħeran syndrome. Ħeran syndrome. So what exactly is Ħeran syndrome? We know it. A female with PCOS, she will have hyperandrogenism, hyperandrogenism. IR for, yes, it is insulin resistance, and AN for acanthosis nigricans. Okay, acanthosis nigricans, which is a marker of insulin resistance. Okay, what exactly is acanthosis nigricans? Acanthosis nigricans is dark, velvety, patchy discoloration over the areas of neck, armpits, okay, in these regions. After that, what else we have to know? Guys, please concentrate in this area. Okay, I am just summarizing. Hormones increased in PCOS, hormones decreased in PCOS. Okay, after syndromes associated in PCOS, I am discussing about hormones which are increased in PCOS, hormones which are decreased in PCOS. Just wait, I just missed a point. See, the syndromes which are associated with PCOS, we know one syndrome is Hormone syndrome. What is the other syndrome? It is the metabolic X syndrome. Okay, just keep these 2 points in mind. Hormone syndrome is associated with PCOS and metabolic X syndrome is associated with PCOS. Now, let's come to our topic. Hormones which are increased in PCOS. What are the hormones, guys? We know all the hormones. What is the first hormone which is going to be increased? It is the increased LH, increase androgens are increased. After androgens, what is going to be increased? Estrogens, especially which estrogens? Estrone. Next, after estrogens, what else can be increased? In some female, it was seen that there is even hyperprolactinemia. Hyperprolactinemia means even in some females there is high levels of prolactin. Now, I have said there is too much amount of androgens. Whenever there is too much amount of androgens, it disturbs the lipid profile. So, you can expect there is a too much amount of LDL cholesterol in the body. Okay, after this, let's see what are the hormones which are decreasing in PCOS. A very important hormone. What is that hormone? It's the FSH is going to be decreased. Next, progesterone is going to be decreased. Sex hormone binding globulins are going to be decreased, and HDL cholesterol is going to be decreased. Okay, we have seen all the hormones which are increased and decreased in PCOS. Now, if someone asks you what is the key hormonal abnormality? Increased LH. What are the clinical features seen in a PCOS female? Hyperandrogenism causing hirsutism, irregular menstrual cycles, anovulatory cycles causing infertility. Next, what else? Insulin resistance, obesity can be seen. Okay, and impaired glucose tolerance because of insulin resistance. What else we have to keep in mind? What are the syndromes associated with PCOS? The syndromes which are associated with PCOS are Hormone syndrome and metabolic syndrome. Guys, please remember, PCOS is the most common pathological cause of hirsutism in females. Let me write it here. Most common cause of pathological hirsutism in females. Again, the answer will be PCOS. Okay, it's a very important MCQ for our exams. And even most common cause of anovulation. Okay, most common pathological cause of anovulation in young females is again PCOS. Okay, so I have discussed all the important topics. The topic of PCOS, I have made everything clear. Okay, please take the notes properly and please go through all the hormones which are increasing and decreasing. Lecture is completed. Thank you.